Ladies and gentlemen, my name is Rob. Welcome back to The Savage Body. Today, let's talk about our elders. More specifically, I want to discuss the 2002 study by Howdy et al. entitled Physical Therapists' Nonverbal Communications Predict Geriatric Patients' Health Outcomes. This article is basically going to say everything that we all need to know about what medicine is, how medical treatment works. Success within the medical profession is not just about giving the right medication, it's not just about doing the right surgery, it's not just about doing the right exercises. It's about the humanity of the thing. RoboCop might have made the best surgeon in the world, but his bedside manner would have been wanting. How would you rate your pain right now on a scale from dead or alive? Research conducted in the 80s and the 90s showed that physicians' speech towards elderly patients was often dismissive, condescending, impatient, infantilizing, and disrespectful. The studies found secondary baby talk in something like 20% of physician-patient interactions. Okay, Gertie, yup, sure. Yeah, just make sure you're taking all your medications. Oh, if it hurts when you do this, maybe don't do that, huh? Ha 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 ha. Okay, I'll see you in a couple of weeks. Bye. Ugh, don't talk to people like that. Unless they're excited about the new Lord of the Rings TV show coming out. It's gonna be so awful. Come on, Rob, bring it back in. What they did in the 2002 Howdy study is they had naive observers rate short videos of the nonverbal communications between 11 therapists and 48 patients that were aged 75 plus that had been admitted to the hospital for functional decline and loss of mobility, right? So they couldn't get up out of a chair, they couldn't get out of bed, they couldn't walk. The observers were tasked with rating the therapists on their positive and their distancing behaviors. Positive qualities were accepting, attentive, competent, concerned, confident, empathetic, enthusiastic, honest, likable, optimistic, and warmth. This also included smiling, nodding, frowning when it was appropriate, and overall facial expressiveness. Distancing behaviors were shrugging, head shaking, lack of smiling, looking away, aloofness, infantilizing, remaining seated when talking to the patient, nervousness, professionalism, which was an interesting inclusion, and of course, baby talk. After processing all the data that they had gathered, they looked at patient progress from admission to 3 months post-discharge from the hospital. And they found that distancing behaviors in a therapist were associated with negative outcomes in general, including decreased activities of daily living, like dressing, toileting, showering, decreased mobility, and overall confusion and depression. Positive behaviors were associated with the exact opposite, both short-term and long-term improvements in physical, mental, and emotional functioning. And the only difference was how positive the interactions were. 2 words, my main man, empathy. Yeah. So what does this all mean? First off, it means that humans aren't just machinery. You can't just swap parts in and out. You can't change the fluids. We're not cars. If all that mattered was doing or saying or fixing the right thing, then a therapist's attitudes towards their patient wouldn't matter at all. We replaced the thing. All better. However, and hopefully I'm not cracking a fresh egg of knowledge on your dome here, but a huge part of the success of a medical intervention is the connection between the patient and the provider, from human to human. It's called the therapeutic alliance. Many placebo-dependent alternative healing modalities only work because of the powerful emotional connection between the healer and their patient. Listen, physical therapists, we spend more time with our patients than anybody else. We have to get this right. Treat your elderly patients as if their lives depend on it, because they kind of do. And this doesn't just apply to therapists and the medical community. This applies to you too. This applies to all of us. Treat your elders well. I'm gonna get on my soapbox here, ready? When you treat other humans with dignity, you redeem your corner of the human race. When you treat them with apathy, with callous disregard, your corner of the ship starts taking on water and going under. And that drags the whole ship under with it. Then we all have to fight that much harder to keep the boat afloat. And you, my callous friend, start looking a little bit like a barnacle. Not cute. Not a good look. Look, man, time flies. One day you're 20, you're strong, you're healthy, you're beautiful, you're sharp as a tack. The world can't touch you. Blink your eyes a couple of times, and you're 80. Your spouse has been dead for a couple of years. You only have a few friends left and George ain't looking so hot. Your hearing aids are on the fritz. You can't remember what day it is. And the food in the cafeteria is terrible.
The food here is terrible. Somebody peed in the lemonade. Fruit garlic.
Does this sound a little depressing? Because it sounds a little depressing to me. When you're that age, do you want younger people to spin through your days like eclipsed moons? Or do you want them to show up like the noon sun, bright and warm? If we're lucky, we're all gonna be there someday, and I hope that we'll have served as positive role models for the generations to come. Also, let me offer a little pearl of wisdom here. I'll take my grandma for example. Old ladies don't really mind that much when you swear around them. If you're cheeky about it, they think it's funny. Obviously, don't go throwing F-bombs around in front of your grandma. But you know, a tastefully used S-bomb, or a B-bomb, or an A-bomb. Talk to them like you're already friends. Maybe a little light swearing, a little joke here and there, and they'll respond well to that. Read the room, obviously. Not everybody's gonna be into you swearing in front of them, but they're not weak. They're not fainting goats. They're not gonna catch the vapors. This is not their first rodeo. Okay, I'm gonna step off the soapbox now. Thank you so much for watching. I hope that some of this information was useful. Start a conversation down below, ask a question, leave a comment, say something about the wisdom of the elders. And remember, I'm in my office all day, every day. If you wanna get a hold of me, do the internet stuff. Go to the website, send me an email, send me a message. You know what to do. Enlighten the mind, elevate the spirit, and make savage the body.